Misconceptions and Stereotypes about Borderline Personality Disorder, BPD, the impact of labeling people with BPD as manipulative or unstable. Borderline personality disorder, BPD, is one of the most stigmatized and misunderstood mental health conditions. The terms manipulative and unstable are often used to describe individuals with BPD, but these labels are both harmful and inaccurate. The impact of labeling individuals with BPD in this way can have far-reaching consequences, both for the individuals living with the disorder and for how society views them. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the negative impact of labeling people with BPD as manipulative or unstable. These labels can perpetuate misunderstanding, fear, and discrimination. By debunking these stereotypes, we aim to foster a more compassionate and accurate understanding of BPD and how it affects those who live with it. 1. The stereotype of manipulative behavior. One of the most damaging labels placed on individuals with BPD is that they are manipulative. This label suggests that people with BPD intentionally use emotional or interpersonal tactics to control or influence others. It perpetuates the idea that individuals with BPD are deceitful and that their behavior is calculated or malicious. Why the manipulative label is harmful. The manipulative label oversimplifies the complex emotional experiences of those with BPD. Impulsive behaviors, emotional outbursts, and difficulty with boundaries can sometimes be misinterpreted as manipulation. However, these behaviors are typically driven by overwhelming emotional pain, fear of abandonment, or desperate attempts to feel understood. Key fact: many individuals with BPD act out impulsively or exaggerate their emotional responses because they struggle to regulate their emotions. These behaviors are often the result of an unmet emotional need or fear of rejection, rather than intentional manipulation. For example, an individual with BPD might become clingy or overly needy in a relationship, not to manipulate the other person, but because they fear abandonment and need constant reassurance. These emotional needs are rooted in deep vulnerability and attachment insecurities rather than manipulative intent. Consequences of the manipulative label. Relationship strain. Labeling someone as manipulative creates distrust and resentment in relationships. Partners, friends, or family members may feel like they need to be on constant alert or defensive, assuming that the person with BPD is always trying to gain control or exploit the situation. Internalized stigma. Individuals with BPD who are labeled as manipulative may begin to believe that their behavior is inherently bad or that they are undeserving of love or care. This self-blame can deepen feelings of shame and isolation, making it harder for them to seek help or engage in therapy. 2. The stereotype of unstable behavior. Another common stereotype associated with BPD is that individuals with the disorder are unstable, emotionally, mentally, or in their relationships. People with BPD are often labeled as being all over the place or unpredictable, which reinforces the idea that they cannot be trusted to have consistent or reliable emotional responses. Why the unstable label is harmful. The term unstable fails to capture the emotional pain and difficulty with emotional regulation that are central to BPD. Individuals with BPD experience intense, rapidly shifting emotions that can feel overwhelming and out of their control. These emotional ups and downs are often triggered by external events, particularly interpersonal interactions, which cause an emotional whirlwind. Key fact: emotional instability in BPD is not a character flaw, but a result of dysregulated emotional responses. It's not that individuals with BPD are unreliable or dramatic by nature, they struggle with regulating emotions, which can result in sudden shifts in mood or behavior. These rapid emotional changes are often a response to the fear of abandonment, emotional pain, or interpersonal conflict. For example, a person with BPD may experience intense anger or sadness over a minor comment or a perceived slight, even if the event wasn't meant to be hurtful. This emotional reaction may appear unpredictable, but it is usually rooted in deep emotional distress that is hard to manage or control. Consequences of the unstable label. Dismissal and invalidation. When individuals with BPD are labeled as unstable, their emotions are often dismissed as being illegitimate or exaggerated. This invalidation can prevent them from feeling understood or heard, leading to a deep sense of isolation and hopelessness. Barriers to treatment. The label of unstable can lead to the assumption that individuals with BPD are beyond help or that their behavior is too erratic to treat effectively. This can discourage both clinicians and individuals with BPD from pursuing appropriate therapy or support. 3. The impact of these labels on individuals with BPD. 3.1 Social stigma. Labeling someone with BPD as manipulative or unstable leads to widespread stigma, which can alienate individuals from society. When the general public holds these negative views, people with BPD may face discrimination, exclusion, or misunderstanding in various settings, whether at work, in social circles, or in their families. Social isolation. The stigma associated with being seen as manipulative or unstable can prevent individuals with BPD from forming meaningful connections with others. They may feel like they are judged or rejected before they even have a chance to show who they truly are. 3.2 Barriers to seeking help. Many individuals with BPD avoid seeking professional help because they fear being labeled as manipulative or unstable by mental health professionals. This fear can prevent them from reaching out for the support they need, leading to prolonged suffering and untreated symptoms. Fear of judgment. The belief that their emotional struggles will be dismissed as dramatic or manipulative may stop individuals with BPD from trusting their therapists or doctors, which makes it harder to develop a therapeutic alliance and make progress in treatment. 3.3 Difficulty in relationships. The labels of manipulative and unstable can make it difficult for individuals with BPD to maintain healthy relationships. Partners, family members, or friends may withdraw or become frustrated, feeling unable to deal with the perceived volatility. Breakdown in communication. When individuals with BPD are labeled as manipulative or unstable, it can create a communication barrier where their needs and emotions are misunderstood. This can lead to an unhealthy dynamic where feelings are either invalidated or ignored, further exacerbating emotional distress and relational conflict. 4. How to overcome these stereotypes and foster empathy. It is crucial to move beyond the labels of manipulative and unstable in order to foster a better understanding of BPD. Rather than viewing emotional reactions as manipulative, we can view them as emotional distress that requires compassion and empathy. 4.1 Education and awareness. The first step in overcoming these stereotypes is to educate the public about BPD and challenge harmful misconceptions. By sharing accurate information about the disorder and highlighting the experiences of individuals living with BPD, we can begin to shift the narrative toward a more compassionate and understanding approach. Key fact: individuals with BPD experience intense emotional pain and fear of abandonment, not malice or manipulation. The behaviors associated with BPD are typically coping mechanisms for dealing with overwhelming emotions, not intentional efforts to control others. 4.2 Compassionate communication. When interacting with someone with BPD, it's essential to approach them with compassion, patience, and understanding. Active listening, validating their emotions, and setting clear boundaries can help build trust and create a healthier dynamic in relationships. Key fact: people with BPD need emotional validation and a safe space to express themselves without fear of judgment or dismissal. Acknowledging their feelings and providing consistent support can help them feel understood and reduce emotional instability. 4.3 Therapeutic support. Individuals with BPD can benefit from therapy that focuses on emotion regulation, interpersonal effectiveness, and distress tolerance. Dialectical behavior therapy, DBT, is particularly effective in helping individuals manage their emotional experiences and improve their relationships with others. Key fact: with the right therapeutic interventions and a strong support system, individuals with BPD can learn to manage their emotions, improve their relationships, and lead fulfilling lives. 5. Conclusion. The harmful labels of manipulative and unstable perpetuate misunderstandings and stigmatization of people with borderline personality disorder, BPD. These stereotypes fail to capture the underlying emotional pain, fear of abandonment, and internal struggles that drive the behaviors associated with BPD. By moving beyond these labels and fostering a more compassionate understanding, we can create a world where individuals with BPD are seen, heard, and supported in their journey toward healing. In future episodes, We will continue to explore the challenges faced by people with BPD and how we can create a more empathetic and inclusive society. Stay tuned for more discussions on borderline personality disorder, BPD, and the importance of challenging stereotypes.